Cal, folks, I have some really good news for you. So RFK Jr.'s Vaccine Advisory Committee is so incompetent that they were not able to even vote on the hepatitis B vaccine for newborns. So what happened was they had two different votes this morning that was delayed. It was supposed to be voted yesterday because they were very disorganized. But the first vote is a no-brainer. All pregnant women should be tested for hepatitis B infection. The problem is that 15% of women do not get tested because of lack of access to healthcare mainly. Now, number two, the vaccine schedule would have changed to say, instead of universal vaccination at 24 hours of life, it said if a mother tests her hepatitis B surface antigen negative, the first dose is not given until a child's at least 1 month old. The second part says they may receive a dose of the vaccine before 1 month according to individual-based decision-making as shared clinical decision-making. But these two statements are at odds with each other. Either you're saying they shouldn't be getting it, or I guess they should be getting it. That's extremely confusing and shows the level of incompetence that this committee has with even coming up with questions to be able to vote on and change the recommendations. There would have been a lot of confusion amongst the healthcare workers administering this because it's not straightforward. Now, I had a chance to watch some of the discourse that happened right before they ended up tabling this vote on their live stream, and it's very clear to me that they're really trying to do whatever they can to put anti-vaccine talking points into the discussion, and they're completely taking things out of context. So Vicky Pebsworth is one of the members who's a nurse, who is a known anti-vaxxer, who at the last second cited a 2013 study trying to say that the hepatitis B vaccine dose caused an elevation in C-reactive protein, trying to imply that that meant that babies were at risk of getting very sick or that it could increase the risk of neurodevelopmental outcomes. C-reactive protein is a non-specific marker of inflammation that transiently rises with any vaccination. It doesn't necessarily mean that it's not safe. The point of that study is that if you are doing a neonatal sepsis workup, you need to know that the elevation in CRP may be related to a vaccine and not necessarily because the child has sepsis. She also noted some safety concerns because there had been reports that babies were more irritable after vaccination, which is true of any vaccine if you give to a baby because it hurts. Even Dr. Cody Meister, who has been on the ACP's panel previously, called her out on it because you don't use irritability as a marker of safety when we're talking about vaccinations. So I'm personally happy with this news because there's really no reason, no new evidence that suggests that giving a dose at 24 hours of life is not safe. And the opposite is true, which is that if you stop vaccinating at that age, you increase the risk of babies developing chronic liver disease that was unnecessary.